Hi, everybody. I'm Gretchyn Bailey. I'm editor-in-chief of Optometry Times, and I am joined today by Ben Casella, who is our chief optometric editor. Hi, Ben. How are you?
Hey, good. How are you?
We are hanging in here. It's a little windy where I am today, so you might hear our wind chimes going, and I hope that our internet stays up to date. But we are hanging in there, and I wanted to talk to you a bit about
Yep.
how you're handling being mostly shut down in your practice and what's going on for you. So tell me a little bit about how your practice has evolved, what you're doing currently, and how things are going.
I would be happy to do that. Currently, I am sitting at home, as as
Aren't
you
we
can
all?
see. Just like I around St. Patrick's Day when the guidelines came out, we immediately postponed all of our routine patients until about the middle of April at that point, and now we're moving them all until about the middle of May. Don't know. It may be that we need to move them again, but it was just kind of like we sat there for a couple of minutes, and then it was just time to get things rolling. Um, that was a few weeks ago at this point, just around 3 weeks. And at first, like all of us, all of us small business owners out there, I was having thoughts and prayers for this all just to end as quickly and as safely as it could, but also having existential thoughts about the future of my business, of my practice, of my livelihood. Um, with the passage of the $2 trillion spending bill, 350 billion of that for small businesses, that has been a certainly a ray of hope. I'm told by my bank that I'm looking good. I'll believe that when I see the money. Have not laid off or furloughed any of my staff yet. I should say I define small business. I have 5 employees, not including myself, so I don't have a huge payroll. So I'm able to keep a little bit on ice. Haven't had to furlough anybody yet, and not planning on it. We're open a few days a week for a few hours a day, which is what most ODs are doing. We are there for emergency care, and we're there only for emergency care. I saw a patient who we thought was having a retinal tear a few days ago, took a foreign body out of a cornea last week, and that's really been about it. Every other thing I've been able to diagnose over the phone or with a picture texted to me. So we've gone from seeing about 150 patients a week to seeing 1 or 2. And we're all in the same situation, and we are just trying to do our part to make sure that that our patients stay safe, make sure that we stay safe, our families stay safe, and we're really just taking it like a half a day at a time, because that seems to be how quickly this is changing.
So let's back up for a minute. You said that you're open for a few hours at a time. So does that mean that you're going into the practice and you have staff there? What does that look like for those few hours a day that you are, let's say, open with?
So that's an excellent question. We are there. We're answering the phone. We're taking contact lens orders. Want to say a big shout out to our contact lens manufacturers and distributors. A lot of them have waived mailing costs, and that's great. Our front door is locked. If you're having an eye emergency, there's a sign on the door. You can call us, you can knock on the door, and if you have something that I need to address, I will take you back myself. And I've got 2 staff members with me. They're answering phones and just trying to get patients rescheduled. We were booked out about 6 weeks before this happened, so we're still calling people. They're on either side of the office. And then on the days that we are there until noon. And then we close up, we leave. I have one employee that has a young child, and she's a single mother, and she doesn't have any child care. And so she comes in a few days a week for a couple hours in the afternoon, where nobody else is there. And I've got everything wiped down where her child can hang out. And she continues to just answer the phone and just try to get all these patients rescheduled. And that's pretty much where we're at. Um,
Well, that's great that you are still working with that employee who's got a small child, and I bet you she really appreciates that, so she can continue to work as well as care for her child. And you're also staggering your times with you and the other two employees there in the morning and her in the afternoon. But let's step
yeah,
back and talk about your patients that you have rescheduled to May. So we're looking at just about mid-April right now, and
right.
a lot of things are shut down to April 30th. And at
Yep.
what point do you decide that you need to push back those patients that you're starting to schedule for May?
Uh, I'll probably decide that we're my internal clock is 3 or 4 days from now is when
Gotcha.
I'm going to make that call, and I'm thinking more likely than not I'm going to have to make that call. But thank you for your kind words about how my I'm trying to work with my staff here. Now's not the time to be mean, Charlie Brown.
That's true. And you said that you haven't laid off or furloughed anybody. So what does that mean, that you're paying them full as you go through, or so they're not applying for unemployment?
Right now, I'm paying them full, and I just want to stress I have a very small staff, and I'm fortunate that I don't have a lot of payroll overhead. I know that I'm very different than a lot of docs out there, but I am doing that for the time being, and I'm hoping to hear in a few days that the small business loan will go through, and I'll be able to keep paying them.
Well, that's great that you're able to do that. And I know that it's been a bit of an onerous process going through all of that paperwork and the application process. And so hearing in a few days is actually pretty fast. When do you
Well,
anticipate that you'll see the cash?
Well, we got an email this afternoon from AOA saying that some doctors were starting to see their small business loans trickle in. Augusta is like a really big neighborhood, and I'm fortunate to have a good relationship with the folks at the bank. And I don't think that they would feed me a line. They say they're optimistic, and so I'm hoping maybe realistically, hopefully end of next week, beginning of the week after. I will say that it is incredible to have to do so much just to prove that you're a business with a payroll, and I totally get it. And anybody who's trying to use any portion, if they're trying to use a dollar of this $350 billion for any ulterior motive other than the spirit of the bill, the spirit of the law, I hope they get audited. But I was asked for various aspects of my corporate taxes, and finally I just said, you know what? I'm just going to sit next to the scanner for about an hour, and I'm just going to scan you all of 2019. And so I did, and I scanned in my quarterly tax payments. I scanned in what I paid in health insurance, what I paid towards retirement, because that all counts,
Oh,
and
really?
that all goes into the loan. It's not just your payroll, and your utilities should be itemized on your corporate tax return. And I've honestly never flipped that far back into it. And so that all counts as well. And if you use the loan over the 8 weeks, I believe it's 8 weeks that you have it for payroll, utilities, rent, health insurance premiums, then it seems as though it's essentially a grant, and they're anticipating that payroll should be no less than 75% of what you use it towards. And they're anticipating that just because they're anticipating just a high volume of people taking advantage of this. But I'm optimistic about it. It's just, these are just unprecedented times. And I've been very careful. When I say that I've had existential thoughts about the future of my business, I'm not complaining. I'm just being honest, because I think a lot of us have. And I'm
Mhm.
very quick not to complain, because it could be a lot worse than it is.
That's true. That's absolutely true. How are you in touch with your patients? Because I know people are saying that communication with everyone is important. Communication with your
Mhm.
staff and communication with your patients so that they will be there for you when you get back. Can you talk a bit about how you're addressing that in your practice, what you've done, how they're responding, how's that working out?
So that's a great question. Social media has been somewhat helpful. I've got it set up to where when I post something on Twitter or Facebook, it automatically goes through the other social media channel as well. And so I'm tweeting my hours. I'm tweeting reminders like if you need contacts, we'll be happy to extend your contact lens prescription a
Sure.
couple of months out. I did that for
I think we froze there.
patient this morning. Um, am I back?
Yep, you're back.
Okay. So if you call us after hours, um, you will be routed. If you have a true eye urgency or a true eye emergency, then you are routed to a phone number, and you call that phone number, and my left pocket starts vibrating, and and I feel as though we are not per se on the front lines of COVID-19, but we have a very important role to play. And the importance of our role has to do with keeping red eyes out of the emergency room. I cannot tell you how many patients I get that they had a red eye. It could have been, it's not like over the weekend or in the middle of the night. It was at 4 o'clock on a Tuesday when I'm open. And they may be an established patient of mine, but they had a red eye and they immediately went to the ER and they were given gentamicin and told to follow up with me in a couple of days. I can't tell you how many times that happens. So I feel really strongly that doctors of optometry, we need to be, and I hear that we are doing our part to keep red eyes out of the emergency room and do our part to help curb the spread of this thing.
Totally agree. For our OD readers and viewers out there, what piece of advice do you have for them that you're finding that's working for you, whether it's making sure you keep your sanity personally with your family because everybody's spending a lot more time together, or it could be in managing your staff or addressing your patients? What are you finding that's working for you that you would offer as advice?
Again, now's not the time to be mean Charlie Brown. As far as on the home front, I, I I can't sit here and try to downplay it. I'm blessed with a really good family, and I know that, and I appreciate that. And the rock of the family is my bride. So lean on your loved ones and know that when it's time, you need to be there when they need to lean on you. Um, you're absolutely not alone, and please minimize your exposure to network news because, because most of what's being said, at least in my experience on network news, and this is not a right versus left thing, this is seems to be a network news thing. I'm not hearing a lot of fact.
I know it's very easy to go down the rabbit hole of news, and I've been doing that myself. That usually throughout the day, I keep the CNN live updates up on
Well,
a
we can't
browser
help it.
window. Yeah, I mean, I want to know what's going on, but it's
Yeah.
also it's not good for your mental state, and it ends up being just such a time suck. And
And
I
one
know
thing,
for
mhm.
me personally, I'm having a hard time focusing on on one task, staying on the straight and narrow to get things done. And I'm betting a lot of people are feeling that just with the ongoing anxiety.
I think that meditation can play a key role in sort of staying in the moment and just sort of being present in the moment. And you don't have to be at home alone in a dark room with the lights off and a candle lit to do it. You can grab a second or two on the go, just to sit and however you meditate. If you have a moment of silence, if you pray, whatever your MO is, I think it's just important to find ways just to be present in the moment. And I'm also blessed with a sense of perspective. My sister's husband, Don, is a pulmonary critical care doctor who works in an ICU a few blocks down from my office. And he defines the front lines of this. And he was supposed to have a little bit of time off, and that's not happening. He has volunteered to go in and to work as hard as he can. And he's the one who's intubating people when they get critically ill. And knowing that he's out there taking one for the rest of us, it really makes me feel like I just need to be present. I need to get through this. I need to get my family through this. I need to get my checking account through this. I need to get my staff through this. I need to get my patients through this.
Right.
And this will come to an end. And whatever the news is, we will.
Right.
I
Well,
think you might
Ben,
have froze for a second.
yeah, I think we did freeze for a second. Well, Ben, this was really great. Thank you so much for talking with me today and for sharing all of this. And I'm sure we'll be
Thank
talking to
you.
you again soon. Thanks so much, Ben.
Talk soon.
All righty. Bye.
Bye.